Heartburn, nausea and vomiting are so common during pregnancy that patients and obstetricians often view it as a completely normal occurrence, with gastroesophageal reflux disease reported in up to 80% of healthy pregnancies. But for moms-to-be, it's nonetheless critical to understand the symptoms, underlying causes, evidence-based treatment options, and clarity as to when to contact your healthcare provider. In that spirit, we welcome you to our special feature, For Her, With Her. An initiative by Alembic CSR presents raising awareness around gastroesophageal reflux disease in pregnancy, in association with the Federation of Obstetric and Gynecological Societies of India, or FOGSI. Please allow me to introduce our guests. We have with us the former president of FOGSI ISR and IAGE, Dr. Prakash Trivedi, the former chairperson of the Sexual Medicine Committee at FOGSI and secretary with IAGE, Dr. Sudha Tandon, former vice president of FOGSI, Dr. Leela Vyas, former vice president of FOGSI and former president of ISO PARB, Dr. Milind Shah, and former chairperson of FOGSI Midlife Committee, Dr. Rajendra Nagarkatti. To the distinguished gynecologists that join us in the room, thank you so much for being here. And for sake of some context setting and for the benefit of our viewers, I'd love to kick off the conversation with you, Dr. Prakash. Give me an understanding of some of the physiological changes or the hormonal changes during pregnancy that typically lead to the exacerbation of heartburn or acid reflux as we know it.
Basically, it's a very routine phenomena wherein gastroesophageal reflux disorder becomes very common.
Right.
So that's for the understanding of masses. When we are talking, they all know they have experienced gastritis, esophagitis, acidity. So we are addressing that aspect more related to pregnancy, and all the panel will elaborate systematically on various aspects.
Sure. And to do just that, I'll come to you now, Dr. Sudha.
Yes.
How does the prevalence of GERD, if I can call it that, typically vary in the first versus the second versus the third trimester of pregnancy, vis-a-vis women who are perhaps not even pregnant at all?
Yeah, I think that's a very relevant question, Pooja. And I think what is commonly known is that the first trimester gives the maximum problems of nausea and vomiting. But when we see the patients who are pregnant, it is just prevalent in about 15 to 20% of the women in the first trimester. And by first trimester, I mean the first 3 months of pregnancy. And in the second trimester, that is from the 4th month or the 6th month, it increases to about 30 to 40% and goes almost to 50% of the women who experience the symptoms of GERD in their 3rd trimester. So that is the prevalence of GERD in the pregnant patients.
So if the prevalence, Dr. Leela, is as high as over 50% during that 3rd trimester, then what are some of the recommended do's and don'ts?
The first thing which we advise for their diet and then their lifestyle changes. Means they are in habit of eating one time more, and in different part of the country if you go, during this pregnancy, the high calorie diet they want to give. So these are the high fat diets and all these diets that gives, because in pregnancy already as mentioned it is common just because of one thing is the pregnancy hormone, which is the progesterone, which decreases the gastric emptying. So the time of gastric emptying increases, so slowly the food passes down. Another thing is that as in the late pregnancy, the uterus grows, the fetus grows, and there is a pressure over that diaphragm, and then they feel that, and also pressure over the stomach that. So the food that from there is a regurgitation of the food from esophagus to that. Because of progesterone, there is an opening of that sphincter, which usually causes, because it gives the relaxation of these muscles.
And perhaps if I could examine the topic from the other side of the equation, and for that I'll come to you now, Dr. Milind. What are some of the complications that typically arise from untreated GERD during pregnancy? How does it demonstrate itself physically? How does it manifest?
Basically, it causes sometimes the aspiration, suppose it is not addressed effectively. And sometimes it can cause even the ulceration as well if it is not treated properly. But quite often, suppose we treat it properly in a given scenario, quite few of these complications can be avoided. Many of them, they get the sleep disturbances, which affects actually the pregnancy outcome as well.
Course.
So we always try to see that we correct that particular problem by giving very simple medication and lifestyle changes. That makes a major difference to avoid these complications.
All right. Well, coming to you now, Dr. Rajendra, the data seems to indicate that GERD is far more prevalent amongst postmenopausal women as opposed to premenopausal women. Help us understand the underlying science in play here, why that's the case.
Yeah, so acid reflux, as we call it, reflux esophagitis, is basically the coming up of the stomach acid into the esophagus. Now, normally that does not happen because, as Dr. Vyas mentioned, there is a sphincter. The lower esophagus has got a sphincter which normally contracts whenever the fluid tries to come up, and it prevents this fluid from coming, the acid from coming up into the esophagus. Now, in patients who are perimenopausal, 50 or above, in these women, there is a drop in their hormones, the estrogens and the progesterones, and that leads to the malfunctioning of this sphincter. The sphincter relaxes and it is not able to function as it normally does. So the acid tends to come up, and that is why it is more frequent, more common in these women.
Well, thank you for breaking it down in layman language, because, this conversation is all about awareness. And speaking of awareness, Dr. Prakash, for the pregnant women out there that may be watching this program, are there certain stages in their pregnancy where such GERD-related complications are likely to worsen? And if so, what are the warning signs?
I think so. One very important thing we have to understand, and what I understood from the panel, we are mixing two issues. First issue is nausea and vomiting in first trimester. That is not GERD. Nausea and vomiting in early pregnancy is because the patient feels that she will vomit, she doesn't eat. So the acidity increases.
Right.
So they are not having any reflux. So they don't take more food. So it's a vicious cycle. So we ask them to break the cycle by having frequent feed and not to keep the stomach empty. When we are talking of GERD, it is essentially more in second and third trimester. So that is different from nausea and vomiting.
No, thank you for explaining that. Yeah.
And then when it comes to second and third trimester, multiple things are mentioned. The most important thing is the production of acidity is controlled by multiple factors. And the contraction of GI tract is also controlled by multiple factors. So apart from esophageal sphincter as the chief culprit, there are many other things which plays wherein, as she mentioned, that the emptying time is reduced.
Right.
So the stomach emptying time is delayed.
Sure.
So what happens is essentially, as the pregnancy advances, she starts feeling, because of the hormonal changes, that is the GI has a reverse action. So that is why some amount of acidity, etc. take place, whether the esophageal sphincter is functioning or defective. Then when you go to third trimester,
Right.
a classical example is a woman will tell, I can't lie down as the pregnancy advances, because when she lies down, everything comes up.
Right.
So when the pregnancy advances, it is suggested that if she is eating, she should finish eating in sitting position.
Sure.
Second is when she is resting, she should rest with her little head raised up. So what happens is the acid reflux factor will automatically go down.
Thank you for setting that context. And I want to take an opposite scenario, Dr. Leela. Not only is the patient not being counseled, but perhaps their GERD is very poorly managed or goes untreated entirely during pregnancy. What are some of the most severe complications that can occur, whether it comes down to aspiration, ulcers, and beyond?
These complications, because the acid will come, so definitely by the disease process, the acid esophagitis and sometimes the ulcer formation also occurs. But the most important thing which occurs, that patient is not eating. So the most important thing, that is, she becomes malnourished. So the malnourished, and then there will be no proper absorption of the food, right. So she will become anemic. Right. So all the complications will be associated with her intake. Because if she is having this acid reflux, she will not able to take even an iron tablet. So the general condition starts from there. And one very interesting thing, if two of the girls are pregnant in family, one is having all nausea, vomiting and all these problems, another is not having, then she is coming. Just check my pregnancy, whether I am pregnant or not, because I don't have that symptom. So this has been taken as a symptom. So many times it has been ignored. So that is to be counseled.
Just because it's common doesn't mean that it's not problematic. A very important distinction there. Coming to you now, Dr. Sudha, to what extent can chronic GERD during pregnancy lead to long-term damage to the esophagus?
See, generally, GERD is taken care of because the woman is miserable. She is unable to eat.
Right.
And she goes to the doctor and the doctor will take care of it. So that scenario doesn't come so often that it leads to complications, by and large, because it is taken care of either by lifestyle changes, as mentioned earlier, the good food and the not so good food that she has to take care of.
Right.
And I think one important point over here is also excessive consumption of tea or coffee. That is caffeine. Caffeine is a big culprit in case of GERD. So I think that is something which she or a family may or may not know. So that is something that she should take care of. And you have the snacks outside. So that kind of food is a big no-no, especially if she is suffering from GERD. So I think these factors which taken into account of the lifestyle modifications, change in the diet, and maybe some medications will take care of majority of the symptoms of GERD. Well, if it is not, then the complications which may occur in very few selected cases, there have been talk of is esophageal ulcers and aspiration, difficulty in sleeping and growth retardation in the fetus because she is unable to eat. But it may occur in very few selected cases if not treated in time.
It's time for a short break, but our special feature, For Her, With Her, an initiative by Alembic CSR, presents raising awareness around gastroesophageal reflux disease in pregnancy. In association with the Federation of Obstetric and Gynecological Societies of India, continues on the other side. So stay with us. I think a common concern during pregnancy is the woman doesn't want to be completely dependent on medication, right? It's a common concern. And hence, what are some of the more natural remedies to address GERD? By way of course, lifestyle modifications and diet changes, but what more above and beyond?
Yes, amongst the lifestyle changes, one thing which is important is they should have small, frequent meals.
Sure.
Another thing, of course, which is easier said than done is to avoid stress. Sure. Because stress is one thing which can also aggravate a GERD. Important also is exercise. Now, normally we say exercise is something which is very good and good lifestyle. But for patients with GERD, it is important that they avoid high impact exercises. Sure. And rather go for simple exercises like walking or even swimming. See, anything like that where you're walking, you're upright, so the chances of regurgitation, etc. becomes less.
Well, in addition to that, one more thing I think we need to tell our audience about avoiding alcohol and smoking.
Sure.
Because nowadays, though women are told that they should refrain themselves from these two particular habits, quite few of them are unable to do that because of the duration. Earlier, they are used to have the alcohol and smoking.
Right.
That definitely causes actually more aggravation or more chance of getting the GERD. And whenever they want to overcome naturally without taking any medication, just a simple mild lime juice makes a wonder actually in those cases. So such advices definitely helps our women to overcome the GERD when it is mild or moderate in the amount.
Could I just add two things which you mentioned, we wanted to know about the natural things, remedies. So I think it's very important to know our Indian kitchen is full of so many herbs.
Yes.
Yeah? And two things which really help is ginger, lime, Dr. Milind has already mentioned, and third is ajwain. Ajwain. If you just take little bit of ajwain, you may add little salt or not add, and just chew it and have water. It has helped pregnant women. It helps even non-pregnant men and women too.
Well, sir, reflux esophagitis has come up in this conversation earlier, as has exercise, right? So I'd love your take on the extent to which exercise can help alleviate this form of esophagitis and why it's more prevalent amongst women in their 50s and above.
Yeah, it's a very wonderful question. Certain exercises which are very simpler are quite useful to strengthen the esophageal sphincter. Just lifting your neck at 60 degrees, suppose any woman or the man does, definitely helps a bit to overcome or avoid that laxity of the esophageal sphincter. And otherwise, routine yogas and the breathing exercises make a major difference. It is basically meditation that she need to observe, especially before sunset, and then she should eat her food and avoid the food after that. Definitely makes a major difference.
And by way of closing comments, and I pose this question to my entire panel, now For Her With Her is of course a CSR initiative by Alembic Foundation, and I'd love your take on the extent to which more it needs to be done by way of creating awareness for these women such that they are empowered in their pregnancies and well beyond.
See, the more important thing is we operated 600 patients a year. What is the first thing our post-operative patient has? Is ice cream, followed by herbal tea. So rather than suggesting complex exercises and complex things, make the patient feel pregnancy is normal, take it easy.
Right.
So if you're having something, you can have yogurt, you can have milkshakes, you can have simpler fruits. That is with all. So my point is we have to tell them to put these breaks. So either soups, milkshakes, etc., etc.
Sure.
Between you and me, I do tell my patients, please order rava masala, rava dosa. I don't have any problem. Sure. Because I don't think so rava dosa is acidic. Sure. So a lot of food which is available over the counter nowadays everywhere is pretty safe for them to have. So they have to select which food to have, and that list we have to give because they will not know. So you can make a fruit, okay, all these fruits you can take except this. So all these juices, all these soups you can take except this. Sure. So what I'm strengthening on this alembic aspect is as much as medicines will come into picture, sure, the bigger part will be how the patient says, okay, in later part of the pregnancy, I will take medicine.
Right.
And we have to be very clear, okay, A, GERD doesn't lead any problem to the child. B, GERD is not going to remain after pregnancy. It will disappear. So you have to make them feel comfortable rather than making a pregnant patient feel that she is diseased.
Right.
So she is normal. She is enjoying her pregnancy.
Right.
So you have to tell, okay, what do you want? You can have this, you can have this. And if you talk about ice cream, there are 15 varieties of ice creams available. Yes. So that's not a problem. And same about milkshakes and so many other things.
Yeah, the simpler intervention, very true. The banana and milk, that makes a major difference as far as the management of the GERD is concerned, sure, by natural ways. And the GERD, because nowadays we always think about the various microorganisms in the body. Right. So when the woman consumes actually the curd or the buttermilk, it definitely helps to improve the microbiome of the GI tract. And that makes a major difference as far as the correction as well as prevention of the GERD is concerned.
And coming to you now, Dr. Leela, given that For Her With Her is an initiative about empowering women, right, by Alembic CSR Foundation, any parting words for our female audience?
Yes, For Her With Her. So I think it's for our patients that we are with them. So it becomes our responsibility. We should spend time with them. To, as Dr. Prakash has said, so many things are there. You can eat this, this, this. You should not eat this in between. For a week, you take this. On the Sunday, you are going outside. You can take. If you have, then we have some remedies you can take. Even it can be a medicine. So they will be very happy. If we'll restrict everything, then they will not come with the next day. They will say, their mother-in-law, I'll not go to this doctor. I'll change this doctor. So For Her With Her means we have to spend time with them. We have to make them understand, yes, it's a normal part of that. Yes, we know that severity should not be there. That is our responsibility to detect any of the thing which is going wrong. But yes, we have to make them understand these are the various options. You take it pregnancy as easy as you can, and you should not be very anxious about these things.
And over to you, Dr. Sudha, your final words.
Suggestion to all my patients is, the two patients are not the same. Like two of us are not the same, you see. Somebody can digest an aloo paratha, somebody cannot digest an aloo paratha. It's as simple as that. So I tell them, you tell me what you like to eat. And it's also important that she's happy. Right. Because eating is not just about filling your stomach. Mentally also you have to be happy. So I tell them whatever doesn't give you any problem, that is fine for you. They should actually go happy from your clinic. But at the same time, it's important that she's not able to eat that much at one time. So frequent meals, in between meals is very important to take care of the acidity. And that little bit of effort she does just carries it in a bag. And that takes care of the minor issues of acidity, is what I tell all my patients.
Well, thank you for sharing that. And Dr. Rajendra, I'll give you the last word.
I think it's a very wonderful initiative by the Alembic CSR Foundation for her, with her. And particularly, I would like to say that our women should enjoy their pregnancies, but at the same time be aware of certain things. And since this is raising awareness about GERD, I feel that they should address the smaller symptoms as and when they happen, like bloating, constant bloating, or the regurgitations, the chest pain, what we call heartburn, constant vomiting. So these small symptoms, if they should not ignore it. Go to your doctor, consult your doctor, and get it treated either by medicines or by home remedies, but get it treated, because as you have already mentioned during the conversation, it is the untreated GERD which gives rise to all the problems. So we have to avoid that, and that is my main message, that be aware of it and try to treat it at the right time.
Pooja, can I make a golden statement?
Please.
A golden statement is whatever advice you are giving, I always keep the mother-in-law and the husband inside.
Sure.
And you always tell, please eat what you want.
Right.
ये ठंडा है, ये गरम है, ये है. You don't in front of them. Now what happens is, when you have clarified with husband and mother-in-law,
Right.
then she can follow very easily, and we are respecting them.
Yes. Well, on that note, Dr. Milan, Dr. Leela, Dr. Prakash, Dr. Sudha, and Dr. Rajendra, thank you so much for taking the time to share such a rich range of insights from your personal as well as your professional journeys alike. And we wish you all the continued success in what you do to comfort patients on an everyday basis.
Thank you so
Thank
much.
you. And with that, our special feature, For Her, With Her, an initiative by Alembic CSR, presents raising awareness around gastroesophageal reflux disease in pregnancy in association with the Federation of Obstetric and Gynecological Societies of India, or FOGSI, comes to a close. I'm Pooja Jain signing off. Thanks for watching.